Hello friends, is it possible that a particular chemical abolishes only a particular taste sensation? Only one taste sensation is gone for a while, whereas other taste sensations are intact. That was the basis for this week's MCQ that I had posted on all my social media platforms. Let's have a quick look at the MCQ, its answer, and the related academic points. A tourist was on safari and he eats some leaves of an Indian plant called as Gymnema sylvestre. People have this habit of just plucking out some leaves and putting it in mouth, just tasting it. So he tried to taste that, and after a while he feels his taste sensation has got altered. He is not able to feel some of the taste sensations. So the question was, which taste would be missing in him for a while, not forever, but maybe for a while. And the options are sweet, sour, salty, and bitter. The answer was sweet sensation. He will not be able to feel the sweet sensation for quite some time after eating those leaves. Let's try to figure out why it happens like this. So here is a chemical present in this plant. There is a substance called gymnemic acid, and this chemical is extracted from the leaves of an Indian plant called Gymnema sylvestre. So this chemical is known to selectively abolish the sweet sensation for quite some time after eating those leaves. So sour, salty, and bitter tastes are unaffected. I always wonder, physiology has so much extent, vast extent, that it comes in every other subject of medicine. This MCQ could have gone as FMT MCQ or medicine MCQ, but it has physiological basis. And I've taken this from Samson Wright's Applied Physiology 13th edition, not the MCQ, but this chunk of information. It's quite possible that this plant alkaloid or this chemical selectively acts on the at the anterior surface of the tongue, anterior corner of the tongue, where there are papillae and taste buds for sweet sensation. As we are all aware, different taste sensations have different taste buds located in various parts of the tongue. So sweet in the anterior part of the tongue, then on the lateral margins we have salty and sour, and posteriorly located is the bitter sensation. So probably those taste buds and the receptors are occupied and completely saturated by this particular chemical, and thereby affecting only the sweet sensation. Now that being said, let's have a quick look at the taste sensation. What are the factors that influence the taste sensation itself? Or taste also called as gustatory sensations. So area stimulated, whether a single papilla or a small area over the tongue stimulated versus whole mouth stimulated by a particular taste chemical, that would influence the taste sensation. Then temperature. Maximum sensitivity for a taste sensation is in the range of 30 degrees to 40 degrees centigrade. Obviously, this is near the body temperature range, and therefore taste sensation will have maximum sensitivity in this range. You might have experienced there is baraf ka gola or ice shreds on which a particular taste chemical is put. It does not influence our taste sensation, or it does not give a taste sensation for too long, and that's because its temperature is near 0 degrees. Then there is a condition. This is where clinical application of this, the condition called as familial dysautonomia. So autonomic imbalance, it's a congenital disorder, and there is inability to recognize taste, or taste threshold is elevated. You would require a lot of concentration of that chemical to be put over the tongue to feel a particular taste, or complete absence of a taste, or that's also possible. Along with that, in familial dysautonomia, where there is this autonomic imbalance. You would have orthostatic hypotension. Yes, of course, because the blood pressure is being regulated by the ANS. Absence of lacrimation and hyporeflexia. And also there is inability to perceive noxious or temperature sensations properly. So these are the symptoms, manifestations of familial dysautonomia. Apart from that, selective taste blindness. Is it possible? Yes, this is what we actually discussed in the MCQ. Selective taste blindness or taste blindness for a particular modality of taste sensation. Now, selective taste blindness also is a condition. It's a Mendelian recessive trait. Very marked rise in the taste threshold for bitter taste. So, in this particular condition, taste threshold is elevated for bitter taste sensation, and that too for certain chemicals that are bitter. For example, phenylthiourea. For this particular compound, the taste threshold is elevated. And finally, dysgeusia. Altered gustatory sensation is called as dysgeusia. So, drugs that cause altered gustatory sensation, particularly commonly known or commonly used drugs are ACE inhibitors, the captopril. Now, this is known to cause altered taste sensation. Now, this drug is very commonly used in the conditions of condition of hypertension. It reduces the blood pressure, but then the clinician has to decide at times whether the quality of life is deteriorating because of the taste blindness or dysgeusia created by this drug, or and therefore use of some other antihypertensive can be advised. Well, so that was about the taste sensation and various academic points related to the taste sensation.